Hello everyone, my name is Ruben Gonzalez. I'm a nutrition and dietetics student here at ASU. I'm a senior and I'm also a patient care technician at DaVita Dialysis. I have been working for DaVita for over 2 years now and I've had many experiences and I've come to see how I can help the patient out and how to prevent them from having any complications during their treatment. So, what if I told you that what you eat or drink either make your dialysis treatment smoother or a very bumpy roller coaster? So with this in mind, the first point that I want to make is the importance of protein in your diet. When you're on dialysis, the treatment removes proteins from your blood. Therefore, consuming the right amount of protein is very essential to your health. So it is recommended to consume protein in the amount of the palm of your hand in order to have an adequate amount of protein for that day. Another important thing about protein is that it reduces the risk of muscle loss and it also prevents you from having infections in your body. So the second point that I'm going to talk about is how much fluid you consume. I can only imagine how it feels to be told how little or how much fluid you can consume during your dialysis treatment or in between your dialysis treatments. So, in a recent study that involves 34,000 dialysis patients who were examined over a 2-year period, showed that fluid gains greater than 1.5 kilograms were associated with an increased risk of heart disease-related deaths. However, fluid gains of 1 kilogram or less was associated with less heart disease-related deaths. Now, the last point that I would like to talk about is the importance of knowing how much salt you consume. Consuming large amounts of salt can cause high fluid retention and swelling in the body, especially in the feet, legs, arms, and hands. So secondly, the large amount of salt in the body can cause a raise in blood pressure, just like an excess amount of water in between your dialysis treatment. They're kind of both related. So lastly, you've all experienced them and you know how it feels. So cramping is associated also with a high amount of salt intake in your diet or in between your dialysis treatments. So the less salt you consume between your dialysis treatments, the less chances of you getting cramps. So to wrap up everything that we talked about today, and what I want you to take home from this is to be mindful of your nutrition, because this will ensure that you have a smooth dialysis treatment and also an overall more healthful life. So thank you so much for your time and attention. Have a wonderful day.